And now I'll turn it back over to Katie.
Great, thank you, Brian. All right, in North Dakota, there are over 80 licensed occupations by 50 boards, agencies, and commissions. During the 66th Legislative Assembly, Senate Bill 2306 was passed to promote license reciprocity for military spouses. The bill also granted the Department of Commerce the ability to request a report from the boards and commissions included in this bill. This opportunity allowed us to further leverage an occupational licensing review and reform grant the U.S. Department of Labor awarded the state in July 2018. In partnership with the subcommittee of the Workforce Development Council, made up of legislators and a cross-functional group of representatives of those affected by North Dakota's occupational licensing framework, including business and representatives of populations with barriers, such as folks with criminal backgrounds, military, and people who are re-entering the workforce. These funds were utilized to research North Dakota's schema for occupational licensing, to develop a thorough understanding of licensing in our state, discover best practices, engage licensing boards and commissions, and identify the best path for reform, with the goal of removing unnecessary barriers to employment while preserving the health and safety of North Dakotans and promoting competition. Over the course of 8 months, this subcommittee learned from subject matter experts from the National Conference of State Legislatures and the Council of State Governments, in addition to the research team from the Council on Licensure Enforcement and Regulation, or CLEAR, who led the data collection process with North Dakota's licensing boards and commissions. Through this work, some of the interesting things we found were that we have fewer boards than we realized. Through a previous study, we believed we had 61 licensing boards. However, through our work with CLEAR, we identified some duplication from that last study and were able to eliminate 11 boards. We now know that we have 50 licensing boards and commissions. We also learned about a practice that has been widely adopted by our licensing boards, which we found out is unique and has created efficiencies in expediting application processing. 30% of our boards empower a designated board member to approve routine license applications, and 61% of boards delegated that authority to a staff member to approve routine license applications. Related to geographic mobility, we learned that many of our boards already have practices in place to accommodate out-of-state applicants. 41% of our boards have informal policies in place to expedite applications for out-of-state applicants or to recognize out-of-state licenses. 20% have formal reciprocity agreements with other states, and 41% have endorsement provisions for out-of-state applicants. North Dakota also belongs to interstate compacts for teachers, physicians, nurses, physical therapists, and emergency medical service personnel. We also asked about boards' compliance with the Military Spouse Reciprocity Bill, which was designed to make it easier for military spouses to get licensed to practice through expedited application processing or the issuance of a provisional license or temporary permit if an application cannot be processed within that 30-day timeframe. Since this bill was passed in 2019, and at the time of this survey in the spring of 2020, we learned that 58 applicants identified themselves as a military spouse, and only one was issued a provisional license. We are encouraged by the success of this bill and see more opportunities emerging to serve this population. The Council has identified the following opportunities to remove unnecessary barriers to licensed employment while preserving the health and safety of North Dakota citizens. The Council recommends removing vague or generic terms, including without limitation, the phrase moral turpitude and good character from licensing board policies, as this language may be interpreted subjectively when processing license applications. The Council also recommends establishing and making public specific criminal convictions that will disqualify an applicant from obtaining a license to practice and implementing a pre-qualification process for applicants who have a criminal conviction on their record in order to prevent the unnecessary expense of training and testing if a specific past conviction will disqualify the applicant from receiving a license to practice in North Dakota. Next, the Council recommends establishing an ongoing system for data collection from licensing boards, commissions, and agencies so future reform efforts can be specific to evolving needs, barriers, and opportunities. This will require a designated office or agency to identify data points and gather these annual reports. Finally, the Council recommends clearly defining who qualifies as a military spouse or dependent and including military personnel under the provisions of the Military Spouse Licensure Reciprocity Bill, Senate Bill 2306, that was passed by the 66th Legislative Assembly. That completes the Council's recommendations on occupational licensing reform.